countryside with his 24-year-old wife Tanya and an 18-month-old baby. Tanya, a housewife, preferred to stay inside the house most of the day with her baby when Akram was away at work. Recently, she began to experience pains in her lower spine, pelvis, and lower joints, which prevented her from doing housework. She was also concerned about the baby, who had not yet started to walk. They consulted a doctor who noted that the baby had bilateral wrist enlargement, lower limb bowing, and frontal bossing. Tanya had confessed that at times she did not feel like eating and disliked milk and dairy products in particular. The doctor warned Tanya that her present lifestyle may have a negative impact on the skeletons of both herself and the baby, and may be contributing to their current health problems. The doctor advised Akram to take a more proactive role in ensuring his wife and baby followed a proper nutritious diet, along with additional supplements he prescribed. He also advised Tanya to go outdoors more regularly with the baby and include some moderate exercise in her daily routine.
Okay, so now we will start the discussion of the objectives with objective number one.
Okay, so objective number one was to basically go over the histology of bone as well as cartilage. I'm going to present on bone. Specifically, we were to focus on the matrix, and the matrix is basically how the bone is made up on the inside. Right, so the objective was the histology of bone, special interest on the matrix. So connective tissue is characterized by the matrix. Like we said, it's just how the inside of the bone is made up or whatever. Inside the matrix, you'll find calcium, phosphorus, as well as many other minerals and the sorts of that kind. When you do like an X-ray of a bone, a compressed bone, you'll find that there are crystals, calcium phosphorus crystals, and they're called hydroxyapatite crystals. So the electron micrographs in them, they show these crystals as plates, and they lie alongside fibers of collagen, or the fibrils, and they are surrounded by ground substance. Now, inside the matrix, you have two things. You have organic substances and you have inorganic substances. The organic substances are the collagens, and the inorganic would be any of the things like what they would call a ground substance, what is basically just there to make the bone hard, and the collagen would make it resilient, kind of like, not sponge-like, but bouncy almost, to take weight and pressure that we use, like just for regular day activities like walking. So there are two types of bones mainly. You have spongy bone and compact bone. So compact bone and spongy bone are found in specific locations in long bones. So you'll have more at the top, and inside, you'll find the spongy bone, and on the outside more the compact bone. So the most thickness of the diaphysis is made of the compact bone, with a small amount of spongy bone facing the marrow cavity. That's just saying the outside and the inside all over again. So the ends, which is the epiphysis of the long bones, they consist mostly of the spongy bone, and is covered with the same shell of the compact bone. Special note, in the skull, the flat bones, they have a middle layer of spongy bone sandwiched in between them. And I think this helps with when we hit our heads sometimes to absorb some of the shock. Okay, so in compact bones, when you look in the microscope, you'll find in the matrix, they have osteons, and it's just like little circles here and there, and they consist of lamella of bone matrix containing collagen fibers surrounding a central canal called the Haversian canal, which contains small blood vessels and nerves. Now that's important because when you look under the microscope, even for like our spot or anything like that, this is how we will determine compact bones because it's so characteristic. So it's just a circle, and inside it's like concentric rings, and centrally you will find the blood vessels and such. And the bone is essential for the blood vessels to be there and working the way it's supposed to make sure that the bone stays alive, because if anything goes wrong with that blood vessel inside that osteon, then you'll have death of that part of the bone, and then it will become all brittle and prickly. So the long axis of osteons are usually parallel to the long axis of the bone. So remember we were talking about the long bones that was in this side, how the compact bone would be found in some long bones and on the outside. So the direction of the bone would be the direction of the osteon.
We can be a little quick in this because we expect that everybody must have read it and come. So you need not explain all those minute details.
Okay, so just the spongy bone now is composed of bone spicules, also called trabeculae, of varying shapes and sizes. And this here is a picture of them, so you could just see. So they're filled with marrow, and they have a lot more spaces in between them, and that's why they're called spongy or cancellous, because they have more space, and this is what allows them to be resilient in weight carrying. So this is just a slide with the parts labeled of both the spongy bone and the compact bone. And then I went over some medical applications of the of knowing the cells of the bones, the osteoclasts and blasts. But I'll just share this online with everyone so you can look at it at your own time. That's all. Thank you.
Okay, thank you. Alright, so we will now move on to objective number 2.
We need the question answer.
Cartilage? Okay.
Question,
Alright, no problem.
she had questions for that, right?
Yeah,
I have the histology question.
Histology is moving.
Okay. Hello. We don't want to conduct the quiz.
Oh,
There are questions, and then you can display the answers with the name of the same. For example, the dry bone, question dry bone.
answer dry bone.
Right.
Okay.
Label.
Yeah.
Volume.
So anybody could label the first part? I'll take that as well.
Quick. 1, 2, 3, 4, 5 seconds.
Blood vessels.
No,
This?
blood vessels would be the black thing.
Oh,
Yeah.
black parts in the inside. So
Sorry,
blood
conjurum.
vessels. Perichondrium.
Bone. Compact bone.
Sorry.
Right, yeah. So cortical bone. Right, that
Five spots.
That's good.
6 squares, eh?
Oh,
The
black.
arrows
The black.
on the blanks.
That would be better.
Maybe you divide yourself in team. The team.
Okay.
Team A and team B.
Team Ever and
So we would already called it.
Okay, elastic has one low and then one top.
Yeah, I think that was one. Maybe.
I think I just don't know
No, you
I think
have to
you have to
focus on one this thing.
Yeah.
For example, you focus here now. So they know you are asking this question,
What is
right? And then this, and then this, like that.
Okay. So now the next one was
So we said elastic fibers for this
Yeah.
one.
Yeah.
So now we move into
I think that's,
well,
I think that's
About
one of them.
So which one would be the blood vessel? Because both of them.
Yeah, they look like chondrocytes.
One of them is chondrocytes and one of
Those
not
two
a
on the
chondrocyte.
elastic called the elastic.
No.
The
I-
fibers.
the clear one with
Elastic
On the left?
fibers.
long arrow.
The one the left hand side.
With that short though.
I'm not sure which one is the
These?
chondrocyte. Yeah. What are those?
I think
So
so.
So we go in.
The one on the right looks like a blood vessel.
Right?
So now you have team A and team B.
No, the one
eh?
on the left looks like
So we have elastic fibers. We go
I
with
say elastic fibers.
blood
I
vessels,
think-
chondrocytes.
Okay, yeah, blank space was named by the captain.
Yeah, it's just.
The biggest.
I don't really point to
Okay,
anything.
okay.
It's
This
just
side
standard
of the
spot.
box represented the center of the abdomen.
I
Oh,
guess basically.
That's
It's
a
hard?
That's
No,
a rest.
no.
That's a
She asked if the size of the box represents the length of the answer.
Okay.
Chondrocytes.
What does the top say?
Oh, this is the name of the slice.
Elastic fibers stained black embedded in the extracellular material.
Okay.
Okay, so next one, so that's two.
Team A and team B.
Anybody
This
can
is
tell me
growth
what?
plates.
So this is for team A, eh?
Growth plates.
Okay, okay.
But we know that because it's on top.
Cute.
That's okay, that's a question.
That's what I say.
And what is this part? I would go with
Which one? I'm not ready for this. That's the one on blood cells.
red blood cells. I thought that would have been like the
Oh, I take that.
You just displayed this.
One side, if that's a good, and then one side
one
has sacrifices.
one has to be sacrifices and one has to be decapifices.
So one is osteoclast and one is osteoblast.
Yeah?
This would be like
Yeah,
Okay, so then here.
that side, that is the plate itself. So that is like the side of
First we have to distinguish which side is which in order to know the direction.
you see in some dark stain, some light stain, and the plate itself.
Right.
Loud and clear, please. Loud and clear for everyone to see.
With the what? Us. The diet side, the osteoclast. And one will be the other.
proliferative side.
Which is the osteoblast.
I think the osteogenic side of the bottom.
Really?
Yeah.
Why so?
Because it looks like it have more alive cells.
Yeah, the top that looking like that.
Dead.
Yeah.
Okay.
So do that.
Sense.
So we here. Now we here.
Oh, what is basically this slide showing actually?
Good.
I think that's
So what are the zones in the growth plate then? Zones. The, yes. The first one is the resting zone. Yes, very good.
Proliferative is the next one.
Okay. And then third one, which your leader is showing?
This one? Where we?
Zero one. From the top. So now maybe
Okay.
But these are calculus, degeneration.
Degeneration zone, very good. So the resting zone, the proliferation zone, maturation zone, hypertrophy zone, and degeneration zone, and osteogenesis zone. Okay.
No, I'm asking, is that kind of
Where? I'm not sure.
Isn't that cell responsible for breaking down of bone?
Oh, they might not be located. Do you think that the osteoclast will be located only in the degeneration
Well,
zone?
not only, but
Majorly. Okay, yes, maybe yes.
that's definitely compartmentalized.
Compartment.
Yeah,
Wait, this is
Alright. On the right.
It's spongy.
Okay.
Is it grounded? Like to get that.
What?
Temperature. Is it grounded?
What?
No.
What is actually the answer?
I think it is.
Very located.
Okay, one more. Okay, so it's not from the bottom.
Yeah.
What is that?
You've done this in lectures as yet? Oh, no wonder you don't know it. Okay, alright, so show them the answer now.
Okay.
That was just how it worked.
Third from top.
Spongy bone, okay.
So that's it for the questions.
What do you have? You have something? Yes, yes or no? Okay.
So we can move on to the next objective, huh?
Okay.
Okay, so I don't know. I don't design right.
Hey, what happened to category?
No, I just
Oh,
go to
do you want to go to medical examination now? Because we don't have to go in CDs for the recording purpose.
Yeah, that would be the exam.
Go ahead and then we can
What do you want to demonstrate?
Huh?
What do you want to demonstrate?
Lower lemma examination.
Okay. No, we are not going to see the purpose of the recording. We are not going to see
We can do
upper lemma.
So,
Okay.
we can talk about it. I just can't get it.
You can close the laptop.
So you finished with the projector completely there?
No, remaining after.
Objectives? Are we presenting?
Later. Not yet. We can do the other things first. The full of energy things first.
Okay.
And then we can continue discussing. I know it may not be making much of a sense to you guys, but for the recording, we don't want the dull things first. Yes, who's your patient? Okay, alright.
So you can push the table.
Oh, we're using
You- Okay. You want to move?
Okay, even if you want to move closer, you all can stand up rather than watching from back.
You just sit. I want to just see where you send down so I can move the camera to suit.
Where are you lie down?
Right, but that's what I was putting
He has to lie down, but let him be on the table.
Then you have to put another chair for his husband.
That's what I say, if you want to go closer, to give it a closer look, you can move. Rather than sitting here, you all can come here. That is it.
no video recorded.
Come closer. Please examine. So, what are the parts of the
One of
examination?
the,
You always ask the questions at the
other
back.
tables would have more, with this on it, that wouldn't be the same level, it wouldn't be more comfortable.
That's fine.
Okay.
Sure. Yeah, cool. So introduce myself like normal.
Yes, 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 yes,
We set the doctor. Yeah. Good evening, my name is Justin.
Loud, loud.
Hi, good evening, my name is Justin Sakman and I'm here at the medical center. I was asked to perform my law examination. Are you in any pain? No. What's your name?
Someone bothered.
What's your age?
19.
So on examination, there appears to be no scars, no muscle wasting, no fasciculations, no tremors. Ideally, you would expose the patient to exposure of the full leg and whatever is
Talk to your
comfortable.
colleagues, talk to your colleagues, tell them.
Right. So
Louder.
now I just tap lightly to see if right. So no muscle fasciculations listed. Now I check for tone.
But what else do you think we should be looking for in inspection?
Scars, masses,
You should be asking these questions.
Swelling.
Any signs of inflammation, any scar of operation?
Deformities.
I didn't mention. Right. That was tone appears to be normal. No fasciculations listed. Right. Now I just ask you to push upwards like
Is this the right way that he is doing?
put it up. Put it down.
What are you examining now?
Strength
Power.
or power?
Is it the right way? Then what is the right way?
It's supposed to.
From the underneath and push down.
It's only two sides, you're supposed to do it.
Wait, what are you doing? No, it's
That's
up
it.
and
Power.
down.
That's what I'm telling. Then come closer and ask him the questions and advise him to do it correct way. The power of the muscle.
You have to ask him to push up.
Well, yeah, you push
No,
down.
you ask the muscle
Well, you
to
don't have to
move
move
against the
it.
resistance.
Yeah.
You ask the patient to move the muscle against the resistance. Right? So for that you need to know the working of the muscle. For example, if you want to test the adductors or abductors and all those things.
Yeah.
So,
Yeah, that's what it is.
so tell the name of the muscle when you are testing.
We didn't.
Thigh
do
muscle.
Okay, alright. Alright.
Thigh muscle. Yeah. Push upwards with this. Right. Push up again. Right. Relax. Push down. Push down. Push upwards.
But remember I had posted a video
Then what? You push.
yes, on Facebook page.
And then is that's
Okay.
yeah. Right. So push upward.
Right, that's it.
Upward.
Mhm.
Upward. Upward. Push against that one.
So even if you have not done, my idea was to introduce to you the concept of medical examination, and kind of developing how to develop the rapport with the patient, with the examination, and kind of a team approach when you are examining a patient. I know that you are not yet into that. You just did your first problem. But in each of the sessions, we are going to do some clinical examination so that you are kind of tuned to it. You see? So for example, the grading of the muscle. Did I post that? The grading of the muscle?
What, for power and so on?
Power of the muscle. The grading of the power of the muscle. Right. Yes.
So,
Zero. Up to 0. From 5 to 0.
5 is full power.
5 is full power,
Full power, yeah.
which means
Against resistance.
overpowering the resistance of the examiner. Right? And the 0 is what? Complete paralysis. Right? But I know that I have taught you the tone. What is tone? Tone in the muscle.
Yeah.
How do you
That's
modify
what I
when
get
you
is
relax,
relaxed.
when you relax muscle, how it sits and how it
It's a kind of partially.
not partial.
Okay, so you will have to revise that. You will have to revise that. Alright, so I hope you all are enjoying doing the part of the clinical touch, so to say, in your problem. So as we will be doing the problem number 2 next week, so we will be doing the facial examination, cerebral palsy examination, how to examine a patient with cerebral palsy. Right? So thank you very much for that. The idea is just to introduce to you the concept of the clinical examination. We have one pamphlet of which he can take the picture. Close.
One of these.
We have one. I want you to take a picture.
This is like his spot on.
Where's the word by?
There is no word by.
No, it means
This generally.
So we need one for
Yeah?
How much time? How much time?
No, it's just to do along as we explain it, so you'll probably figure it out sometime in life.
Let's touch the fan on the laptop and see something.
Yeah?
Okay, well, we'll start with development. So, in terms of the development of the skeletal system, it's from, it comes from which layer of the apparatus of bodies?
Meso.
So, in the mesoderm now, you have like different sections, right?
Yeah.
So, first you have the neural crest in the middle, then you have the paraxial parts, then the intermediate mesoderm, then the lateral plate mesoderm. So the parts of that form the skeletal system are the neural crest, not the intermediate, the lateral plate, and well, parts of which one is the ones? And the ribs. Yes, yeah. And then the submetameres will join with the neural crest to form the bones of the face and the skull. And then from the lateral plate mesoderm, that would divide into the splantopleuric and the somatopleuric layers, right? The somatopleuric layers will go on to form the upper limb, the lower limb, and the sternum. So this is all development.